Real psycho.
What a great place to start the recording.
It's funny.
Muting now.
Yeah, I captured all of that, so I don't. So just so y'all know, it's all recorded, being turned in over to the authorities at Amberton. So
Great.
Well,
might
if
be
they
in there.
show up at my house, they can kind of just wait in line. Of priority, I'm good with it.
Um, I have no idea what y'all are talking about. So, um,
We were talking about the Enneagram numbers.
oh, okay, awesome. Trying to get my color not to be not orange or blue. Good grief, what's happening here? How's everyone?
Apparently, we're
Uh,
chatty, but we're good.
Hey, I like chatting. It's a lot less awkward than just staring, at people staring back at me silently. Um, sorry, I'm running a little bit behind. My son ran out of toilet paper right before this. So if you've got kids, then you kind of know the emergency that is. So we've got a time limit before he takes action, and we don't want him taking action. Because yeah. Well, how's everybody getting along with uh the week and everybody have a good weekend? Yeah.
I'll volunteer. It was parents' weekend. My daughter's a freshman in college, and it was parents' weekend. And that was such a weird experience.
I bet it was. I
It's
bet
weird.
it
It's like,
was.
are we sure there aren't like more adults here? Because I'm not sure I qualify.
And what school does she go to?
She goes to UNT.
Okay. All right.
She's not
Well,
far from me.
I can't imagine when my daughter is and son go to college. I can't imagine a weekend not being a parent weekend because I'll probably be down there uh too much. My daughter's already like, Dad, you're gonna have to prepare for this. That's what she said about college. She's 9. It's
Mine
like,
used to say the same thing, and if I don't come go see her, she comes to see me every weekend.
well, I like I told her, I said, the more I'm around, the probably the more money you're gonna have. So, it's a trade-off. I'm easily bought as a dad, for sure. Um, so I'm gonna open up our course material stuff here on Moodle. I've got a 100, almost 101 fever. My
Oh
my
no.
my wife has a fever, and so does my daughter, and they're all in there. And my son has no fever. He's 100. He's 200% okay. Um, and so if I sound a little weird, that's kind of what's going on. But I mean, I sound weird all the time, but if I sound like extra weird tonight, that's what's happening.
Oh, my son's
Um,
sick right now too. Something's going around.
I'm telling you, every evening for the past like week, my daughter and I have like the same person. Um, she has all the same allergies for the most part as I do, but when we get sick, our face turns red because we both have real big cheeks. And I knew it as soon as I picked her up from school earlier. I was like, that girl is sick right there. She's got glassy eyes. And then we took her temperature, and lo and behold, she had a fever. My wife was like, well, let's take everybody's temperature. And I did too. But I told her that it's probably from all the push-ups I got through doing today. Just kidding. Oh, I didn't do any push-ups. Um, with um, with tonight's class, It's essentially the last, really, I would say the last stop on the train, so to speak, before we just dive, head first into all the assessments. Although I do want to start talking a little bit through a little bit more about the Enneagram, and a little bit more about not a little bit more, and kind of introducing two other concepts: one, IQ testing, and then also share with you all some of the presentation that I did for the Northeast Texas Counseling Association, their conference, where I did an evaluation, a presentation on advanced assessment of ADHD. And so I don't want to spend too much time on that because that's going to also be covered if you take psychopathology or are taking it. I don't want to, have you listen to my jokes twice, but for those who aren't, it'll be a good kind of mini crash course. And what I'll do too is I'll upload in Moodle my PowerPoint slides from that presentation. That way you'll have that at least, and it'll be something that can put you to sleep at night. Just turn on like Siri or like a soft voice and have it read it. And nobody's laughing, man. I'm sick and I'm still making jokes, and y'all are not like just.
I'm just muted, but we do dad jokes all day long in our house.
Not even like a pity laugh at this point. It's like, oh, he must be delirious. Okay. Well, all right. That's okay. I'm used to it. My daughter didn't. I mean, it's fine. It's fine. My feelings are okay, I think. So I also want to give you guys an opportunity to ask questions related to anything and everything that is the course material up to this point. And yeah, and so if you have any questions, yeah.
The midterm is it the midterm next week?
So the midterm is open and will remain open all the way until the end of the semester, which is I think November 15th.
16th or something?
Yep. So it's the 15th, it looks like, at 11 a.m. I don't know why it's 11, because the time changed. That's why. Okay. I'm going to change that. But yeah, it's open to take. And you have 3 untimed attempts. Only the highest grades counted. Can y'all believe have people fail that thing before?
It's all multiple choice? Okay.
I'm not sure how you felt. I mean, like,
and open book.
Right.
Yay.
And three attempts.
Okay. I'm not sure how I missed that it was already open, but thank you.
Sure, absolutely. I will put that on me for not making that clearer. And it's probably on me for not doing that. But yeah, so you've got that open. Any other questions, like practical questions or anything like that?
I have a question with the paper we are supposed to write. I can't seem to find where the instruction is.
The instructions are so at the very top of the course where the purple and green brain are, and my weird picture there. If you keep going down underneath the Zoom class schedule, and it has all the dates listed out there, and just keep on going down, then you'll see announcements, get to know your fellow classmates here, and then the assessment project guidelines. And then I could probably just, let me see if I can put that in the chat. Oh, Yeah, so that's, you can download it there. Has everybody else found it? Find it? Awesome. Well, how's the course material so far?
A little
It's
dry.
great.
A little dry. Not everybody at once. Like nobody's talking until I said it's a little dry.
The parts with the what we covered last week, where it's all of the equations and the statistics and that's a lot. But then
Sure.
once you get into like the SAT and the ACT and all that stuff, it's like, okay.
Now, here's a question. Really, I would say this. So let's go over just some basic stuff that I really think that will be helpful just to kind of hit home again. But who can tell me the difference between reliability and validity, and what's the relationship between the two?
Oh, I'll take a stab. And I'm just trying, one is not synonymous with the other, right? Like validity means the test is like solid, valid, like you're testing what you were meant to test, and reliability or testing for, you've captured what you wanted to include in the test. Am I somewhere in the realm here? Let me think.
Yeah. Is it measuring what it's intending to measure? Yep.
Yes. And then the reliability, is it like, does it stand up against the other tests? Like, can you prove it statistically that it's like a reliable test, right? Something
So
like
that's
that.
still validity, but that's a good guess. So reliability does it consistently measure what it's intending to measure?
There.
So that's where have you ever seen let's see, let's see if I can share this with y'all.
And can you
Yeah, 1
repeat
second.
validity as well?
Yeah, so validity, can y'all see that?
Yes.
So validity is, and there are several different types of validity, by the way. If you think about it this way, just kind of zoom out, let's decomplicate or deconstruct it a bit. When someone says like, hey, your emotions are valid, what does that mean?
They make sense. You can understand why they have those emotions.
They're reasonable.
Sure. And so in other words, your emotions are a reflection of your experience, right? Like your emotions are an accurate depiction of your experience, would be another way of saying that. Would y'all agree? Sure. So validity, that word is, I would say, synonymous to accuracy. Okay. So here is, so validity is going to be on this target system here. It's going to be these X's in a tight circle. They don't have an example. I don't know why they don't have an example. It's kind of frustrating. And then also within the bullseye. So validity requires two things. This is important to remember on a test, not probably on my test, but definitely on the licensure exam. Validity requires that you measure what you're trying to measure and that it measures that consistently. Okay. What would be an example of a test that measures what you're trying to measure, or let me see if you can think of an example of a test that measures what you're trying to measure, but that is reliable, like just any kind of test, just, whatever you think of.
A driving test?
Yeah. And why? Why is that? That's a great example.
Because it's measuring what you're trying to measure for accuracy. You're trying to measure that the person can accurately drive according to whatever the region's laws are. And then it's reliable because the action of doing the driving test will tell the tester if they can or cannot drive.
Okay. Break that down, that second part for me, because the question, and I think I wasn't clear in my question too, but I agree that it's probably a valid test, and most of the time it's reliable, but it's not necessarily a reliable test, because as you get older, you would expect there to be an increase in driving ability, right?
Mm-hmm.
And so when you take it, let's say at 16, I happen to know somebody personally who's now a professor and is a private practice neuropsychologist that didn't pass the driving test at 16, who is a good driver now, guys. Okay. I promise I am. But I didn't pass it the first time. Okay. And so well, that's not a great example. The accuracy wasn't great back then, but nor was it reliable, because I would say that I have definitely improved. And then as you get older, we would lose the ability, right, to drive. And what you need to know is, as it relates to like performance-based testing, so like we're talking about IQ testing, academic achievement testing, reaction time, memory, attention, all those things, even like physical functioning, the more difficulty that you have in that domain, the wider range of error we're introducing into a test. In other words, when you give an IQ test, we'll use IQ for example. When you give an IQ test to 1,000 people of the same age who are, otherwise have perfectly healthy brains, you get a normal bell curve. It's evenly distributed, right? Everybody agree with that? Good, because you should. That's the right answer. When you give that same test to 1,000 people with different psychiatric conditions or cognitive disorders, things like that, or even medical illnesses, would you suspect there to be a normal bell curve with those folks? No. And why not?
Neurodivergence? I don't know.
Definitely,
Maybe
there's a much more neurodiversity within that group for sure. So think about.
Can you repeat the question or rephrase it?
Sure. So if I gave that same IQ test to, let's say, a group of individuals all the same age, except this group, we didn't screen out for, we let everybody in, including those who have medical illnesses and cognitive disorders and psychiatric conditions. Would you expect that bell curve to be normal? And especially as compared to the healthy group that we gave it to, who we all agree do have a normal bell curve or a normal distribution of test scores.
No, it wouldn't be normal because you've got more variables
Ah,
across the population that could affect the scores and the curve.
absolutely. So because of that, there's that's called variance, by the way. There's a variance there between test scores, and there's a greater standard error of measurement. Y'all remember that word or those words? Yep, standard error measurement means if I test somebody 100 times, I'm not going to get the exact same score every time. I'm going to get like a range of scores. The better the test is, the narrower that standard error measurement is, i.e., the more reliable it is, i.e., the more valid it is. Does that make sense? Now, I'm talking about that other distribution of scores because as it relates to understanding validity and reliability, the fundamental concept that you kind of learn right now is like you've got to have reliability first in order for a test to be valid. That's true for healthy populations. But sometimes we give tests that are not very reliable because we're testing individuals with dynamic conditions, or we're testing a dynamic condition. For example, like depression. You can give a depression questionnaire that might be very valid at measuring what it's supposed to measure. But if you give that test at 2 points in time before treatment and after treatment, do you expect the same score? No, it's not very reliable. Would y'all agree? Yeah, but it doesn't detract from the validity. So that's the advanced like concept. In my opinion, that's grad school. Like undergrads kind of understanding the valid. I'm not saying, by the way, I'm not calling you undergrad. If you're still trying to wrap your head around validity and reliability, trust me, that concept just comes when you just immerse yourself in all this stuff. But you do need to know those fundamental concepts that beyond that standard for healthy populations, when you start assessing populations that have different conditions, or you're assessing variables that are dynamic over time, the reliability is expected to go down, but the validity should remain the same if it's a valid test. Right? Does anybody give me an example of different types of validity?
I can out of the book.
Hey, let's do it. What does the book say? What kind of validity do we have? Hey,
There's criterion related validity, which includes concurrent and predictive. And there's construct validity, experimental design validity, factor analysis. I don't know, all those. Yeah.
so what happened was,
validity.
yep. So what happened was psychologists who also ended up being statisticians, I guess, got bored and were like, you know what? There's not enough types of validity. We need to make some different types of validity. Let's break it down to like different, types, subtypes of validity. I imagine in my head that they kind of threw like a party or something, and there's like 3 of them. And it was real awkward because they didn't really want to talk to each other, but they divide the different types of validity into subcategories where I would argue, and you'll see your text and other texts argue that what really matters is ecological validity in the long run. In other words, does this test actually measure this patient or client, whatever trait we're trying to measure? Is it measuring it within the typical environment that most people are. So I'll give you an example. When we do our testing at my office, like let's say with a little kid, we've got one-on-one, testing technician administering tests, redirecting, giving instructions constantly back and forth, steering the car, so to speak, but there's not a lot of wiggle room for that kid to get distracted. Right? And so I can measure how they do in that setting and get a valid result, let's say of their IQ under more ideal situation, but the ecological validity isn't great because they probably don't perform to that level, because the vast majority of the rest of life, you don't have somebody face-to-face directing traffic the whole time. Does that make sense?
I have a question. So would that mean, in that example, would that mean that, again, the test is valid, but it's not reliable because there's that wide range of, if you take it out of the therapy setting, then there'd be a wide range, even though it was a valid test to have the person administer.
Right.
Okay.
And you won't, so I'm teaching you this stuff because when you get out, I always say like when you get out as if y'all are in prison or something. When y'all get out of prison, when you graduate, if you ever decide to, do different tests, you'll read in every single manual and they boast about, our test's the most reliable since the word reliable was created. Like it's always like they're talking about wonderful reliability, which is awesome. And that's the stuff I have to defend in court. But there is a significant difference between that reliability, where we are doing something in a controlled setting for a specific population, in a one shot, or close in time proximity, as compared to the real world, where we're actually trying to take these results and generalize those results to the real world as it relates to meaningful information.
Okay.
Okay. Which is why, by the way, here's a good example. The attention, there's a continuous performance test called the IVA2, which is what I use in at my practice. It's for ADHD, and it's 20 minutes. I think I told you about it. It's like 20 minutes of the most boring voice you've ever heard saying 1 and 2, with the numbers 1 and 2 flashing on the screen just like that. And every time you hear one or see a one, you're going to click your mouse as fast as you can. 20 minutes. Okay. Now, that test is a good example of a test that has high validity for what it's trying to measure, which is ultimately, how do you do compared to everybody else who also took the test? How do you do on this extremely boring test? How much gas do you have in your gas tank, and making yourself focus for an extended period of time? Right? Well, how many tasks are you doing throughout the day that are that boring? I hope none, by the way, guys. If you are, let's talk about it. I'll help you find something more meaningful, because please don't do that all day. I have to give that test all day, and that's bad enough. I can hear it in my head all the time. When I go to sleep, 1s and 2s, I'm clicking. I'm like, dream twitching when people twitch, but it's my finger. I'm clicking the mouse. But that test is valid at capturing how you perform on a task that is extremely boring, and it's only for 20 minutes. And so, like, if I try to generalize that information or determine if it's valid for somebody or ecologically valid for a college student, where they're trying to study for hours, maybe something that is not as boring, but pretty boring to them, that test starts to lose its validity. Does that make sense?
I have a question.
Uh-huh.
Cause this is just making me think. So when my son was little, he's 16 now, but he was maybe 4. We took him for a speech assessment, like at a speech therapy office, and he bombed it. They were like, "Oh my gosh, this is so terrible." Well, we were like, "Let's get a second opinion," and we did it through the school district. And when they pulled him in for an assessment, they played with him. He played with like his favorite toys and trains, and they were like, "He's great. He might need like a little help." But they were like, "He's doing great." And I was like, "Whoa." Like, but the way they administered, I don't know if they used different tests completely, or it was just the way they administered it. Like, does that make it not reliable? I don't know.
That's a great question. So most of our tests, I can't speak for all of speech language pathologists, but so they give similar tests to what psychologists do, but primarily in the speech language domain, obviously. Sometimes with autism a little bit too, but so you've got standardized tests, right? When I say standardized, you've got a standardized set of instructions. It doesn't matter who you are. We should be able to program that into a computer, and it will administer exactly the same way every single time, right? Well, most of these tests aren't computer administered, meaning that you have to kind of train or get trained in how to administer. And literally, it's memorizing those instructions. And I'm so thankful that I've made room. I've gotten rid of all that stuff because I had to memorize all those instructions. But there's always a little bit of variability there, and especially as it relates to therapeutic like stance, because what we absolutely know is the better the rapport you have with the person that you're assessing, the more valid and more reliable your results will be. I see it a lot with kiddos who are now like young adults where they're coming in. I'll give you an example. I had a person with that was tested and had an IQ in I think it was like the high 60s as a 12-year-old and was diagnosed with intellectual developmental disorder by the school. Not diagnosed, but labeled as such. Went on to receive disability, social security disability. I saw them at like when they were 20. Gosh, actually, to be honest with you, it was when they were 28 whenever I saw them. Still on disability. Nobody had reassessed it ever. Their IQ was 105, which is the 63rd percentile with me. So they had lived over, what is that? 16 years of their life on disability, assuming that they were disabled for an intellectual disorder that they did not have. When I asked the patient about it, they said, well, looking back, I remember I was really angry and mad, like just that year, because that was like when puberty hit. And that's also when, and it's also when dad had died or like had their parents had split over or something like that, but it like had some significant events in their life. And they said, I remember the person testing me because I remember the blocks because, we gave block design. That's a sub-test from, like, I remember doing that test. And I remember that person getting mad at me and like slapping my hand whenever I tried to grab one of the blocks. Like they went like that to my hand. And you know what their other diagnosis was with the IDD? Oppositional defiant disorder.
That's awful.
So,
And also, I have to say that when teenage boys reach a certain age, I don't think I'd want to have them IQ tested until they're maybe a little older, because I feel like common sense is like gone for a little bit. So maybe that's not fair to test at certain times or ages. Or when you said puberty, I was like, yeah.
So believe it or not, IQ testing, if you tell them that this is an IQ test, I've never had a kiddo. Well, I've had kids, but not teens. I've never had a teen who didn't like give it every single thing they had. Like for some reason, just taking like knowing this is an IQ test, I've literally had a teen that refused to give effort, and they were like, I tried hard, and like they did worse than people without a brain on everything except for their IQ tests. Their IQ test was like 115, 84th percentile, and the rest of it was like less than first percentile on attention. Well, you can't be less than first percentile on attention and do that well on an IQ test. If that were the case, you couldn't be administered an IQ test because your attention span is too low. Does that make sense? Yeah. To be honest with you, well, and here's what's important, because I want to talk about IQ testing next, is with all the tests, the validity, I'm sorry, all performance tests, what we know is about 40 to 60% of the validity can be attributed to how hard that person tried at the test, or how hard, not how hard, but the amount of effort they put into that test.
I know this is going to come up probably in the reading, but I'm just so curious how you test IQ. Like, what are you looking at? Like,
Sure, that's a great question. Well, there are a few different theories of what IQ actually can be defined as. While those are also limited, there are several different types of intelligence. First of all, what I tell patients and what you can tell your clients is IQ is kind of a overall summary of how well do you problem solve, just in general, as compared to your age and gender matched peers in most cases, or if it's kiddos, sometimes age and grade matched peers, okay, who have no history of anything. So these are the peers that have never been diagnosed with anything, have no learning disabilities, or no medical conditions, no psychiatric illnesses, nothing like that. So as compared to them, how do you problem solve? How well do you problem solve? That's what IQ is measuring.
so at what age can you guys start testing for IQ?
I can test it all the way down to, well, technically you can test it down to, I think it's 11 months with different like Bailey infant scales that there are out there. Now, the reliability and validity at that age is quite low. In other words, you can test an 11-month-old, you get like, a low score, test them a month later, and you get a high score. Because I'm here to tell you, if that 11-month-old accidentally pooped their pants right before and you didn't know, they're going to score really low, right? Would that be a good example? I would hope. Let's just all shake our head, because I can't imagine trying to take tests like that. So the younger a person is, the less reliable a test is going to be, and ultimately the predictive validity decreases as well, even though the construct validity stays the same. Construct validity means, is the test measuring the variables that we designed it to measure? And then the predictive validity is, does this test accurately predict their future performance on the same test? And a test can have low predictive validity, but high construct validity.
What is the ideal age to test IQ at? If you're going, like, what stage of like brain development would you want?
For healthy populations or not?
I guess both. Like,
okay. I would say the most accurate you're going to measure, my confidence starts to grow in the tests that are out there and the ability to actually reliably measure it, meaning like they're going to be able to give the same amount of effort most days. around age 6 or 7. But you can go a lot lower than that. I'm trying to think. Yeah, the younger they go, though, from there, the tests are more challenging to administer in a standardized measure, a standardized manner, because whatever instructions that you have memorized, if you're trying to take the time to read out the manual, like, okay, now we're going to wait, I'm gonna show you some I'm gonna show you some blocks. If you do that for like a 4-year-old, well, you're done. You don't have that kind of time. You got to have it like burnt into your brain. It's got to be straightforward. But even then, a 4-year-old is going to have a wide range. There's a big difference between 4 years and 4 months and 4 years and 11 months. Okay, so there's a lot more variability. So going back to your question with IQ, let's talk about that real quick. IQ can be further divided down into different component parts. And really what we're talking about, when you hear the word cognitive testing, that's the same thing. This intelligence testing is cognitive testing. And then there is what's called neurocognitive testing and neuropsychological testing. And you can do, this will be a little bit confusing, but it's kind of funny. You can give an IQ test to measure intelligence, to measure cognitive abilities, and to measure neurocognitive or neuropsychological functioning. Same test. It depends on the context. It depends on your training, really.
You can just mute me, but I just have a question. Like,
no, that's great.
At what point do people say, like, hey, I need you to get an IQ test? Like, what are they presenting with that you need that information to know, like, your IQ is this, so it is affecting this? Like, what symptom or what is coming up that they're like, oh, you need an IQ test?
Right. So generally it's in childhood with delayed milestones. So if we're considering like not necessarily early childhood intervention, that's a little bit younger than what IQ tests on average go to. Plus there's just nobody that knows how to give tests like that down that low, but for the most part. But usually there's delayed milestones. There are concerns about different diagnoses. Maybe autism is a concern. Maybe genetic syndromes have been identified. And we would measure an IQ, one, because it's formally required in order to diagnose an intellectual disorder. So it used to be called mental retardation, but now it's called intellectual developmental disorder. And in order to diagnose that, you have to have administered a gold standard, like legally acceptable objective test of intelligence, which is maybe like 3 or 4 different tests. So there are like the Wechsler tests. There are the the Woodcock-Johnson test of cognitive abilities. There are Stanford-Binet tests. I think there's also the wide range intelligence test, the Reynolds. The COGAT would be another one. That's what schools sometimes give. Now, that's not, I'm going to say the COGAT only because it's included in the IQ or a cognitive test, but it is not an acceptable test to diagnose intellectual disorder, just so you know. That's just a side note. I'm going to show you guys. Have you ever seen the IQ testing or IQ tests? All right. Let's see. And I remember whenever I took my IQ test in grad school, because they had to practice on us, like the older, the upperclassmen. And they're like, Armstrong, get in here. It's time for your IQ test. And just so you know, this is an IQ test, can be kind of hard. I was like, great. I'm sure you're not going to judge me at all either. And I was so nervous in the whole thing. I scored really low on my processing speed. Let me pull it up.
I'm so curious if schools are testing the kids like for their IQ without even like us knowing, but they're like assessing.
No, so yes and no. So I don't think every student gets the COGAT, but I can't remember if they do or not. They may like at certain grades throughout the time, but it's usually group administered. And I'm here to tell you, any group administered test for kids, it's not a great way to measure anything with kids. Because you cannot control for, the kid in front of you picking their nose and flicking them over their head back onto your table. I mean, I remember that whenever I was in kindergarten. Remember that. Still remember that guy's name too, by the way. Yep. This first thing my mom was like, how's first day of school, kindergarten? I was like, well, this kid, blah, 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 just picking his nose, flicking it over his head. So that's how I started school, guys. Don't start school that way. And so with IQ testing, we've got, here, let me show you.
I have a question while you're looking.
Yeah.
Is the kindergarten entrance test, is that an IQ test of sorts?
Is the kindergarten what test?
It's the kindergarten readiness test, where they do the assessment to see where they're going to be in kindergarten.
That is a pre-achievement test or a pre-academic skills test. So like basically it's assessing that test has high predictive validity, or at least in theory, it has high predictive validity of where a child may score, in second or third grade. And so they'll give it in order to determine which kids are at risk for needing additional services right now to get them caught up. And then, which ones might we need to identify for like gifted programs, stuff like that. Yep. But again, as you can imagine, the validity of that test is going to hinge on a lot of different stuff, including how nice was the person? Was the kid hungry, right? Were they sleepy? And did you try to test them right before recess? All kinds of stuff like that.
They did a test with my daughter to see if she should skip a grade. And the question that she asked them beforehand was, what happens to my friends? If I skip a grade, what happens to my friends? And they said, your friends will all stay where they are. You'll just be in the grade above them. She even misspelled her name. She got every question, because it was like there's right, a sort of right, and almost right, and a completely wrong. She got every question, the completely wrong answer, and spelled her name wrong.
Wow. I guess I don't blame her.
I thought, well, that was a stupid thing to let her. I mean, why would you even tell her? Just give her the test. It would have worked out fine.
Right.
Yeah.
Yep. So this is the sample item that, in order to give the instructions, this is called the matrix reasoning test. It measures, gosh, I'm trying to give you a broad, real fast crash course rundown of what types of IQ you can objectively measure. You can measure verbal IQ, which is like verbal problem solving, obviously dependent on language skills and vocabulary acquisition, and obviously age and education level. Okay. So if we tested your IQ at the beginning of grad school compared to the end, your IQ would be improved, I promise you, because your verbal IQ score would go up. Yeah. Now, with that said, you can measure perceptual reasoning, or what a lot of people would just more easily define as nonverbal IQ. This is what you're looking at as an example of this. So this test is called matrix reasoning. And the instructions is, I'm going to show you a pattern on this page. You've got an apple, apple, banana, apple, question mark. Which one of these might go here? Anybody have a guess? It's not a trick question. I know everybody's like, wait a minute. I don't want. It looks
Banana.
The
out. There you
banana
go.
goes there, yeah.
Number 2. Yep. So that's the easy one. Let's do another one. There's another one. What number might go there?
3.
Good. All right. Let's see. Do another one here. We're about to jump up in difficulty, folks. Just letting you know. Oh, the same one. One second. Oh, here we go. You'll see that one? That's a little bit harder, huh?
5.
So that would be, which one?
5.
5.
There you go. Good job. So if you made it there, and y'all all easily would, your IQ as an adult, I know, because this is number 19, if you can make it to 1920, your IQ is approaching the 25th percentile. Okay, so it's if you can get this one right, in other words, pretty good chance that your nonverbal IQ is in the 25th percentile. What is nonverbal IQ? It includes a lot of different stuff, but really it's concept formation. It's the ability to recognize patterns, not just visually, but just overall in life, even like abstract metaphorical patterns, and use those patterns to logically sequence and deduce what or predict what might come next, right? That would be a higher order reasoning. Let's see. You want to try a little bit harder one? I call this the hamburger one. And I don't know their answer. I'm gonna have to look up the answer. I don't have it memorized. Which one is that? I can't remember. Let's see. Do I have a guess? Nobody's guessing. That's okay. Let's see. What number was that one? That one is
Yes.
26.
Can't see it. There we go. Oh,
Oh,
can't
here
see
you
it.
go. Sorry. Here you go. I didn't know it switched the pages on me whenever I'm looking at just something different.
I would guess 3, but that's just a guess. I don't know.
Right?
No, 4.
And that happens too, by the way, especially with kids. They'll say, number 1. Nope. Number 3. Nope. Number 5. Nope. But then when they do that, they'll also look at you. They'll go, number 2. No, not number 2. They're like trying to gauge your reaction. And that's what's hard about testing kids, just so you know, is that they will do that unconsciously. And you, because you're not a psychopath and you're a compassionate person, you will be more likely to congratulate them or say good job whenever they get it right. And you'll be less likely to do that whenever they don't get it right. And they'll start picking up on that whenever you're testing them. Yep. I've had them do that, and they said, oh yeah, I must have gotten the last 2 right. I was like, why? They're like, well, because your voice is different whenever I get it right. You're always like, great job. And then when I get it wrong, you're like, great job. I didn't even recognize it was happening. Let's see what the right answer is. Do a new share. Here's what the record form looks like. That was number 26, I think. What was it? Yeah, number 26. So it would be, the answer was 2. That one. So now we're into, by the way, hey, Thomas, thank you for guessing. Just putting yourself out there. Completely, if you made it this far, now your IQs for adults is approaching about 135, 140. So 99th percentile. And it goes even further. You want to see the hardest one real quick? It was like, no, not at 7 p.m. at night. I haven't eaten dinner yet.
We're still seeing that matrix page.
Are you really?
Yeah,
The matrix page.
I thought that's what it said. Matrix
This one?
reasoning.
Yeah,
Uh-huh.
yeah. I'm about to share the harder
Oh,
one.
okay, okay.
Yeah. But number 26, the answer was 2. And say that. Let me find it. Oh yeah. 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 Can y'all see that?
Mm-hmm.
Now I've tested about 25,000 people at this point. And I can tell you, I've had one patient ever make it this far. And they got it right. I know the right answer based on my little score sheet, but I have no idea how you get the right answer on it. Does anybody want to guess? So I do have to wrap us up.
I'm gonna guess 1.
Good guess. We'll see what the answer is. I don't
I think
remember
it's
what it
1.
was. Y'all going with 1? All right. Anybody else? That's kind of like the Price is Right. I'm gonna split it in half. 5. Right? You guess high, I'm gonna guess low, or opposite.
Whoever gets the closest without going over.
Exactly. Wins the car. Yep. Let's see.
So it doesn't tell you what the pattern is with the answers?
It does not.
Hmm.
Which is unfortunate. So the answer was 2,
Hmm.
which was, go back to that page. This one. So all the ones y'all win the car. You get to proceed. I got to go back to my seat. At least I was on TV with Drew Carey. So if you get this one right, that's as far as you can go. Your IQ is about 155. No, 160. Close to 160.
Wow.
And just so you know, beyond about 115 IQ, which is the 84th percentile, you could be an IQ of 1 billion, and there's no qualitative difference between the 84th percentile and the 99.999th percentile in relation to what you can and can't do in life. Everybody wants their IQ to be off the charts, and you'll have family members. Oh yeah, you do IQ stuff. Well, I think I took that one on Facebook is like 300 IQ. It's like, well, I'm not sure about that, but IQ, the higher it goes, the less variability in day-to-day functioning there is. The lower it goes, there is increased variability. So you can have somebody with a really, really low IQ that has a high level of functioning, that would otherwise maybe be able to live independently, but still have an intellectual disorder. Or you can have somebody with an intellectual disorder who also can't live independently, has all kinds of functional deficits to go with it. It's really kind of interesting. But all right, I'm gonna pause this there. Any brief questions before I turn us off here?
I have one real quick question about our paper.
Sure. Okay.
Some of the content I've written about in papers for my other classes.
Uh-huh.
if I pull some of that information, do you want it referenced as pulling from those other papers, or can I just pull it in and since it's my own?
That's a great question. So I would say I would do a fun thing and cite yourself.
Okay.
Because that's what, like, if you were if you were like publishing stuff, let's say you had a publication and then you reference that, you would cite yourself. Even if
Okay.
you don't publish it, you can still cite yourself. Yeah.
Okay. I just wanted to prevent any kind of, like you're looking for, that I'm taking it from somewhere else. So it's like, but
Rhonda,
it's
I love
mine.
that you, Rhonda, I love that you think I have that kind of time. I'm just kidding.
Well, that's what those tools are for, right? Those turn it in tools or whatever.
Yeah, but it's really every professor has their own philosophy there. Mine is that if it's your work, I mean, I don't care if you resubmit the paper. Like if you've already written it, that's fine. If it fits everything, great. Like hopefully you're building on top of it, but like I'm not gonna police like, did you already turn that in? Like, well then you better pretend like that didn't happen and just rewrite it and make it all brand new. But no, just
some
you can
do.
incorporate it. Yep. Because that's what people who publish do. I mean, it's literally like they'll cite themselves as they go.
Okay.
Makes a fun day in court when the judge is like, wait, so Dr. Armstrong, did you cite yourself there? Yes, I did.
Yes, I did.
Any other questions? All right. Well, I am gonna take my second dose of Tylenol and get ready for my next class, but I will I have yet to publish the last class that I've recorded. I get both of them put up there either tonight after class or tomorrow morning. So and then we will keep going next class. Sound good? Awesome. You all have a great rest of your evening, and we'll see you later.
Thank you.
Thanks.
All right.